Influenza, commonly known as the flu, is a contagious respiratory illness that can affect anyone anywhere. Recognizing the early warning signs is crucial for timely treatment and preventing the spread to others. In this video, we'll walk you through the first symptoms to watch out for, so you can act quickly and protect yourself and those around you. Let's start by understanding what makes the flu different from a common cold and why early detection matters. Catching the flu early can make a big difference in how quickly you recover and how severe your symptoms become. Early detection allows for prompt medical care, which can reduce complications, especially for vulnerable groups like children, the elderly, and those with weakened immune systems. By knowing what to look for, you can also help prevent spreading the virus to family, friends, and coworkers. Let's dive into the most common early warning signs of influenza. One of the earliest and most noticeable signs of the flu is a sudden high fever. Unlike the gradual temperature rise seen with a common cold, flu-related fevers often appear quickly and can reach 100 degrees off 38 degrees C or higher. This rapid onset is a key indicator that your body is fighting off an infection. If you or someone you know experiences a sudden spike in temperature, it's important to monitor other symptoms and consider seeking medical advice. Chills and shivering often accompany a high fever and are another early sign of influenza. These sensations can come on suddenly, making you feel cold even when the room is warm. Chills are your body's way of raising its temperature to fight off the virus. If you notice yourself or someone else experiencing uncontrollable shivering, especially with a fever, it's wise to pay attention to other flu symptoms that may follow. Flu often causes widespread body aches and muscle pains, which can be quite severe. These aches usually come on quickly and can affect your back, arms, legs, and joints. Unlike the mild discomfort of a cold, flu-related aches can make it hard to move or even get out of bed. If you suddenly feel sore all over, especially with other symptoms like fever or chills, it may be an early warning sign of influenza. Feeling unusually tired or weak is another early sign of the flu. This fatigue can be overwhelming, making it difficult to carry out daily activities. It often appears before other symptoms and can last for several days. If you notice a sudden drop in your energy levels, especially when combined with fever or aches, it's important to rest and monitor your health closely. Sore throat can be one of the first signs that the flu is starting. The discomfort may begin as a scratchy feeling and quickly progress to pain when swallowing. While sore throats are common with many illnesses, when paired with other flu symptoms like fever and body aches, it's a strong indicator that influenza could be the cause. Dry, persistent cough is another early warning sign of the flu. Unlike the wet coughs often seen with colds, flu coughs are usually dry and can be quite irritating. This cough may start mildly but can quickly become more severe, making it hard to sleep or talk comfortably. If you develop a sudden, nagging cough along with other symptoms, it's time to be cautious. Headaches are a frequent early symptom of influenza. These headaches can be moderate to severe and often come on suddenly. They may be accompanied by sensitivity to light or sound, making it hard to focus on daily tasks. If you notice a sudden, intense headache along with other flu symptoms, it's a sign your body may be fighting off the virus. While not as common as other symptoms, nasal congestion can occur early in the flu. You might notice a stuffy or runny nose, which can make breathing uncomfortable. Although congestion is more typical of a cold, its presence alongside fever, chills, and body aches may indicate the flu rather than a simple cold. Sudden loss of appetite is another early warning sign of influenza. You may find that foods you usually enjoy no longer appeal to you, or you might skip meals altogether. This loss of interest in eating is often due to the body's response to infection. If you notice a drop in appetite along with other flu symptoms, it's important to stay hydrated and rest. Some people, especially children, may experience mild gastrointestinal symptoms early in the flu. These can include nausea, vomiting, or diarrhea. While these symptoms are less common in adults, they can still occur and may be mistaken for a stomach bug. If you or your child has these symptoms along with fever and fatigue, consider the possibility of influenza. Some individuals may notice eye discomfort as an early sign of the flu. This can include redness, watering, or a gritty sensation in the eyes. These symptoms are usually mild but can add to the overall feeling of being unwell. If you experience eye discomfort along with other flu symptoms, it's another clue that your body is fighting off an infection. Sweating, especially night sweats, can be an early warning sign of the flu. As your body fights the infection, you may wake up drenched in sweat or notice increased sweating during the day. This is often a response to fever breaking, and while it can be uncomfortable, it's a sign your immune system is active. Dizziness or feeling lightheaded can occur early in the course of the flu. This may be due to dehydration, fever, or the body's response to infection. If you suddenly feel dizzy, especially when standing up, it's important to rest and drink fluids. Persistent dizziness should be monitored closely, especially if accompanied by other symptoms. Some people may experience ear pain or a feeling of pressure in the ears as an early symptom of the flu. This can be uncomfortable and may be mistaken for an ear infection. If you notice ear discomfort along with other flu symptoms, it's another sign to watch for, especially in children. Mild shortness of breath or difficulty breathing can sometimes appear early in the flu, especially in people with underlying health conditions. While severe breathing problems are a medical emergency, mild symptoms should be monitored closely. If you notice any changes in your breathing, especially with other flu symptoms, seek medical advice if it worsens. Some people may experience confusion or a sense of brain fog as an early sign of the flu. This can make it hard to concentrate, remember things, or think clearly. These symptoms are more common in older adults but can affect anyone. If you notice sudden confusion, especially with fever or other symptoms, it's important to rest and monitor your condition. Irritability or mood changes can be an early warning sign of the flu, especially in children. You may notice increased fussiness, crankiness, or difficulty calming down. These changes often occur before more obvious physical symptoms appear. If you or your child becomes unusually irritable, keep an eye out for other flu indicators. For people with chronic health conditions like asthma or diabetes, the flu can cause these issues to worsen early on. You might notice increased shortness of breath, higher blood sugar levels, or more frequent asthma attacks. If you have a chronic illness and notice your symptoms getting worse, it could be an early sign of influenza. It's important to distinguish flu symptoms from those of a common cold. While both illnesses share some signs, flu symptoms tend to appear suddenly and are more severe. High fever, intense body aches, and extreme fatigue are more typical of the flu, while colds usually cause milder symptoms like a runny nose and mild sore throat. Recognizing these differences can help you respond appropriately. While most cases of the flu can be managed at home, there are times when you should seek medical help right away. Warning signs include difficulty breathing, chest pain, persistent vomiting, confusion, or a high fever that won't go down. Vulnerable groups like young children, elderly adults, and those with chronic illnesses should be especially cautious. Don't hesitate to contact a healthcare provider if you're concerned. Rest is one of the most important things you can do if you notice early flu symptoms. Giving your body time to recover helps your immune system fight off the virus more effectively. Try to get plenty of sleep, avoid strenuous activities, and listen to your body's needs. Resting early can also help prevent complications and speed up recovery. Staying hydrated is crucial when you have early flu symptoms. Fever and sweating can lead to dehydration, making you feel worse. Drink plenty of water, clear broths, or electrolyte drinks to keep your fluid levels up. Proper hydration helps your body function better and can ease symptoms like headache and fatigue. If you suspect you have the flu, it's important to monitor your symptoms closely. Keep track of your temperature, note any changes in breathing, and watch for new or worsening symptoms. This information can help your healthcare provider make the best recommendations for your care. Early monitoring can also help you recognize if your condition is getting worse. If you notice early flu symptoms, take steps to avoid spreading the virus to others. Stay home from work or school, cover your mouth and nose when coughing or sneezing, and wash your hands frequently. These simple actions can make a big difference in protecting your community and loved ones. In some cases, antiviral medications can help reduce the severity and duration of the flu if taken early. These medications are most effective when started within the first 48 hours of symptoms. If you're at high risk for complications or have severe symptoms, consult your healthcare provider about whether antivirals are right for you. Getting an annual flu vaccine is the best way to prevent influenza and its complications. While the vaccine won't prevent all cases, it can reduce your risk and make symptoms milder if you do get sick. Vaccination is especially important for high-risk groups and those who work in healthcare or with vulnerable populations. Practicing good hygiene is essential for preventing the spread of the flu. Wash your hands regularly with soap and water, avoid touching your face, and disinfect frequently touched surfaces. These habits can help keep you and those around you healthy, especially during flu season. A strong immune system can help you fight off the flu more effectively. Eat a balanced diet, get regular exercise, manage stress, and ensure you're getting enough sleep. These healthy habits can make a big difference in how your body responds to infections. Certain groups are at higher risk for severe flu complications, including young children, elderly adults, pregnant women, and people with chronic health conditions. If you or someone you care for falls into one of these categories, it's especially important to watch for early warning signs and seek prompt medical attention if needed. Flu season typically peaks in the fall and winter months. Being aware of local flu activity can help you stay vigilant for early warning signs. Pay attention to public health announcements and take extra precautions during peak times to reduce your risk of infection. There are many myths about the early signs of the flu. For example, some people believe you can't get the flu if you've had the vaccine, or that only high fever means you have influenza. In reality, symptoms can vary, and even vaccinated individuals can get sick, though usually with milder symptoms. Understanding the facts helps you respond appropriately. Children may show different early warning signs of the flu compared to adults. In addition to fever and fatigue, they might experience irritability, loss of appetite, or gastrointestinal symptoms like vomiting. Because children can become seriously ill quickly, it's important to watch for these signs and seek medical advice if you're concerned. Older adults may not always develop a high fever with the flu. Instead, they might show early signs like confusion, weakness, or a sudden decline in daily functioning. Because the elderly are at higher risk for complications, it's important to recognize these subtle symptoms and act quickly. Pregnant women are more susceptible to severe flu complications. Early warning signs may include fever, fatigue, and body aches, but symptoms can progress quickly. If you're pregnant and notice any flu symptoms, contact your healthcare provider promptly for advice and care. Recognizing early flu symptoms is important because complications can develop quickly. These can include pneumonia, bronchitis, sinus infections, and worsening of chronic conditions. Early treatment and monitoring can help prevent these serious outcomes. Most people with early flu symptoms can recover at home with proper self-care. This includes resting, staying hydrated, eating nutritious foods, and using over-the-counter medications for symptom relief. Monitor your symptoms and seek medical help if they worsen or you're in a high-risk group. You should only return to work, school, or other activities after your fever has been gone for at least 24 hours without medication. This helps prevent spreading the flu to others. Listen to your body and don't rush your recovery. Rest is key to a full return to health. Flu and COVID-19 share many early symptoms such as fever, cough, and fatigue. It can be difficult to tell them apart without testing. If you have symptoms of either illness, follow local guidelines for testing and isolation to protect yourself and others. Public health agencies track flu outbreaks and provide updates on local activity. Staying informed can help you take precautions and recognize early warning signs if there's an increase in cases in your area. Check reliable sources for the latest information during flu season. If someone you care for shows early signs of the flu, offer support by helping them rest, stay hydrated, and monitor their symptoms. Encourage good hygiene and help them access medical care if needed. Your support can make a big difference in their recovery. Dealing with the flu can affect your mental health, especially if symptoms are severe or recovery is slow. It's normal to feel anxious or frustrated. Take time for self-care, reach out for support, and remember that most people recover fully with time and rest. To recap, the early warning signs of the flu include sudden fever, chills, body aches, fatigue, sore throat, dry cough, headache, and sometimes gastrointestinal symptoms. Recognizing these signs early can help you take action, recover faster, and prevent spreading the virus to others. Stay alert and take care of yourself during flu season. If you notice any early warning signs of the flu, don't ignore them. Rest, stay hydrated, monitor your symptoms, and seek medical advice if needed. Early action can make a big difference in your recovery and help protect those around you. Stay healthy and informed this flu season.